My name is Akwasi, Dr. Akwasi Ahmed. Akwasi Ahmed, or sometimes Akwasi Ahmed, because having 4 names is a bit long. I was born in Accra. I'm the first of 4. The youngest is also a boy with 2 sisters in between. One thing our parents, especially my dad, always used to say is you don't let anyone come to you without leaving happy and better. They taught us the importance of good morals, respect for the elders, truth, being truthful all the time, loving God. Going into senior high school, my mind was that I was going to be an electrical engineer. I wanted to invent things, create things, things electronic, because that's what my passion was, doing things with my hands. And then after senior high school, that changed a bit, and it changed with my grandmother. I used to see how she suffered, stiff joints with arthritis and, all that. So I realized that there was a higher calling, So that's when I decided I probably wanted to go into medicine because I could make more of an impact in medicine. The cataract blindness in Ghana is huge. There's a huge backlog. The cataract surgical rate, which is the number of cataract surgeries that should be done every year per median population, should be about 2,000. And currently we are doing less than 1,000. At a point in time we had about 80 ophthalmologists just the past few years. And then this 80, you find out that 70% were concentrated in Accra, 30% in Kumasi. And even of this 80, some of them were retired. So it was very few people actually doing surgeries and trying to cure the huge, for example, what we're doing here, the huge cataract blindness burden. One of the core features, or one of the core things that Daybreak wants to do is residency training. Komfo Anokye is the hospital where I work, the teaching hospital where I work, and I'm involved with residency training, with surgeries and giving lectures and helping them throughout the training. And I see this as an extension, of what I do there, through Daybreak. Apart from impacting people and impacting lives, individuals and families and communities and populations, also empowering the young residents to also get enough skill. You can finish as an ophthalmologist in Ghana and you're not very good surgically or clinically. Attending these camps gets you to experience a lot of cases at the time, manage complications. So by attending 1 or 2 or 3 of these, you find out that you feel a bit more confident and competent as a resident to be able to go back to your facility and institution to be able to deliver good care. Outreaches like this are so important because with about 120 ophthalmologists now, you come here, 5 doctors come, 6, 7 doctors come in a period of 5 days. And then we're doing 800 surgeries. We are giving sight to 800 people. If you close your eye for just 10 seconds, that feeling of darkness, or that feeling of, not seeing anything. The eyes, there's a reason why they say the eyes are the window to the soul and the eyes are the windows to the body. If I put myself in those patients' situation, if I was those patients and I had these white cataracts and I couldn't see, and to take them off and then to have this patient see the faces of their grandchildren, to see the faces of, their family members. It's something, to behold. Before my grandmother died, she had cataracts, and in medicine you usually will say you don't operate on a very close relative. So I remember taking this frail old woman I was a resident then, taking her to the hospital where I work and getting one of my colleagues to operate on her. Now when we took the patch off the next day, you know what she said to me? She looked at me and said to me that she didn't know this is how I looked, meaning that she knew how I looked, but she hadn't been able to see my face so distinctively in such a long time. She used to see me as shadows, so she'd see like a shadow because her cataracts were quite dense. So for me, that was so impactful. To me, I think it's a blessing. I think it's a calling. I think it's doing God's work, and it is doing God's work as people here on earth.